Dr. Sue Page AM is a past president of the Rural Doctors Association of Australia and current board member of the Northern NSW Local Health District, North Coast GP Training, and the Australian Medicare Local Alliance. As Associate Professor with the University of Sydney, she links to the Northern Rivers University Centre for Rural Health, a collaboration between that university and the University of Southern Cross for the delivery of multidisciplinary health professional education in Australia. Until 2010 she was the inaugural director of the North Coast Medical Education Collaboration, a venture linking the University of Sydney, the University of Western Sydney and the University of Wollongong, which established year-long training for medical students in rural areas and later combined with the UCRH. As clinical lead for education for the RAC, Dr. Page headed a review of national curriculum and the move toward outcomes-based learning with statements able to be uploaded onto smartphones. She assisted in the creation of the college's new Fellowship of Advanced Rural General Practice, the FARG, which includes processes for recognition of prior learning for rural GPS in established practice. She has championed the uptake of telehealth in Australian community-based practice with roles in the Government Department of Health and Ageing Telehealth Advisory Group, conference speaking engagements and contribution to RAC telehealth resources including a new active learning module. Page previously held the position as inaugural chair of the North Coast Area Healthcare Advisory Council within the NSW Department of Health, New South Wales Department of Health Area Health Services, and is a rural GPVMO at Ballina District Hospital and St. Vincent's Hospital in Lismore. A fellow of, and supervisor for, both RACP and ACAREM, she has postgraduate training in the early management of severe trauma, a diploma in shared care psychiatry, eating disorders, and a diploma in obstetrics through the Australian and New Zealand College of Obstetrics and Gynecology. Her practice includes primary health care within an Aboriginal community, and used to involve obstetrics at Ballina Hospital until the unit was closed due to workforce shortages. Identified as one of the top 10 people in Australia influencing general practice, Dr. Page was recognised in the Australian Honours as a member of the Order of Australia on Australia Day, January 25, 2008. Dr. Page received her award for service to medicine and to the community through commitment to improving access to health and medical services in rural and remote areas, and through professional, educational, and advisory roles. Page has been instrumental in bringing cross-sector organizations together to work to common goals. Amongst achievements are listed contribution to resolving the 2003 medical indemnity crisis in Australia, the establishment of a dedicated training program for procedural general practice, and negotiating Australian Medicare item numbers for nurses working within general practices for procedures such as pap smears and for allied health professionals caring for patients with chronic and complex disease. She continues to promote collaborative working arrangements in primary health care, and to inspire the next generation of health workforce through a variety of speaking engagements.